We are here today, Danielle Farias is going to talk to us about QT breast imaging. And the reason I asked her to talk to us about it is number one, she runs a facility. And number two, I think it's a really important new imaging modality that we need to know about, because my hope is that this is going to be where maybe the future of breast imaging goes. But Danielle, you take it from there.
Sounds good. So, yes, I'm Danielle. I run the Clarity Breast Imaging in El Dorado Hills, California, and I'm your QT breast tech. So, I am the hands-on experience and can kind of tell you the whole process of what happens and how it differs from different screening modalities, and then the expectations of the report as well. So, QT imaging is amazing and it differs entirely from all other screening modalities because not only is it radiation free, it uses ultrasound, but a low frequency ultrasound, which is completely different than handheld ultrasound. And that's one of the biggest questions I get is, okay, so you use ultrasound, how is it different than handheld? And so handheld actually sends the sound waves to the breast tissue and then it bounces back and then it receives those frequencies and then it creates a image based on that. The low frequency and the way that our whole scanning process is different is you're laying on your stomach and your breast is actually in a vat of water. And then the machine is kind of like a half moon around it. And then it circulates around the breast every 2 millimeters. And then it sends the sound waves through the breast instead of bouncing back. So it actually goes through and reads the entire tissue layer in each 2 millimeter layer that we're getting, which is fantastic for dense breast, which is very difficult to screen for in mammography because cancer and breast density both look white. So this is actually FDA cleared for dense breast. So it's a not only just fantastic from what I'm saying, but the FDA is also saying that it's fantastic for that. And then the radiologist can actually go through each of those layers that's scanned from nipple to chest wall to look through the density, which is something that's very unique about this. And then another unique thing that I always love to talk about is the doubling time. So if we have a suspicious area that we're looking at in the breast, and we just kind of want to, it has suspicious qualities. Maybe it's a oblong shape or it has a high frequency, and we just kind of want to see what the growth pattern is on it. So the QT has a specific knowledge on the doubling time. And so you come back in 6 months. This is on the radiologist's recommendation. This isn't for everyone. And then we can actually do the doubling time to see if it's a quick doubling time, which falls within a range. And a quicker doubling time will be more likely to be malignant. And then if it's outside of that range, it's actually more likely to be benign, which is really cool. And then on top of that, we have one of the main reasons that QT scan was invented is the false positive rate for all the other screening modalities is extremely high. So mammography, the false positive, and so if anyone who doesn't know what a false positive is, it says that you have a possible suspicious finding, you get a biopsy and it comes back and it's benign. And 80% of those biopsies come back benign. So it's extremely high. And then even in MRI, there's false positive, and that's almost 50 to 75%. So that's also extremely high. And so one of the main purposes is to reduce the amount of false positives. And so QTs is only 11%. Nothing's perfect, but that's extremely lower than the other screening modalities that are out there. Even handheld ultrasound is 90% false positive rate. And if anyone who has had a biopsy can definitely attest to it's a stressful experience. So basically, you get your report. It says, okay, it looks like you have something. We need to do a biopsy. And then you're stressed out that entire time. And then you get the biopsy. It's not a comfortable experience. And then you get your report and you get the sigh of relief. Okay, it's benign. Fantastic. I'm so glad we got to know that. However, if we can reduce the amount of women that have to go through that, that's
Right.
fantastic.
Totally agree. Like I see that with mammogram, not unfortunately, not uncommonly.
Right.
False positives are pretty common. People go down and they have to get more images done. And it is, for any woman and any of their family or friends, it's a super stressful
And stress isn't
cause of
good for
what
breast
it's doing.
cancer risk.
Right, right. Yeah. And I think we kind of miss the radiologists say, well, we use radiation to treat breast cancer. And I'm like, well, it's probably different, right?
A little bit
Yeah.
different. I would hope
So,
so.
so it is, it's a frightening scenario for anyone going through it, or even any man going through it.
Yeah,
It
more men
definitely is.
are coming up with having a higher risk of breast cancer, which is terrifying.
Right. How, like, are there other QT facilities, Danielle, or?
Yeah, so we're only one of six in the country right now,
Okay.
which we're trying to spread more facilities, all of us, everyone who's a part of this, just because we want more women to have accessibility to it. I have women flying out of state every week. I actually had my first Canadian last week, so now it's international. So more and more women are craving a no radiation, a more comfortable experience. I'll get into that on like what the entire experience is
Okay.
like, and more higher specificity on what we're looking at in the breast, especially almost half the women population have dense breasts. So that's already half the female population where mammography alone is not solely a great option for them. They'll need additional imaging regardless.
Right. Like, so if people wanted to come down there, this is probably really early to ask you this question, but fly into Sacramento?
Yes, Sacramento International Airport. We're like
Okay.
30, 40 minutes east of Sacramento.
Okay.
So very
Okay. So
manageable.
I mean, somebody outside of Alaska will probably watch this, but for my peeps in Alaska, Sacramento's not too far.
No, it's not too bad. It's just a hop over the pond.
Right, right. Yeah, like what, go into telling us a little bit more about this and
Yeah, okay, so I'll get into the process of it. So once you come in, we get you undressed from the waist up. We just have you put on a robe, and then you come in. We talk about your breast health history. If you have any post breast cancer experience, I do have a lot of post cancer warriors coming in because they just really don't want any more radiation exposure. And then once we go over that, take note of any scarring, implant scarring, lumpectomy, etc., like that. Any scarring can actually obscure imaging, so it's important for us to note where it is on your breast. And then we get you laid down on the scan. So you're not in a vice grip, which is way different. So you're on your stomach, and then there's actually a hole that we put your breast in. And then we center you on there and make sure you're all comfortable. And then we lower you down into the water. We also put a tape with a magnet, and that holds the breast in place because it connects to a rod in the center, and that holds everything in place so your breast isn't moving around in the water and you get a clear image. And
Mhm.
then once you're down there, it's usually about 10 to 15 minutes each breast. And I will say I usually have a couple of women fall asleep each week. So it's that comfortable that you're relaxed and you want to fall asleep. I also play relaxing music too, so that probably aids in the wanting to sleep factor.
So not noisy like an MRI is.
No, it's kind
Excellent.
of a humming sound from the machine, so it's not intimidating.
Good.
And
Good.
you're not in something like an MRI. I've had a lot of women who have claustrophobia and they call and ask me about that. So it's open. So you're just laying down and everything's open above you.
And I presume the water's warm.
It is body temperature, which
Good.
is, I always get giggles. When I lower them down into the water, it's such a bizarre feeling because it's the same temperature as you. So it just kind of feels like a weird, like, whoop around your breast, and I
Uh,
get giggles around it.
awesome.
hmm
So about 15 minutes for each breast.
Yep.
So whole thing is 35, 40 minutes.
Yeah, we allow an hour for the whole appointment, and that's
Okay.
everything involved. But the scan itself is about 20 to 30 minutes.
Oh, very cool.
hmm And then after that, we just get you all set and then go over that. It usually takes 1 to 2 weeks to get the report back. As long as everything's good. For my women that are just coming in for screening, we just upload it to the patient portal. If there's anything suspicious, then I, of course, call and let them know. And then whatever the next steps would be, which is normally to follow up with your primary care to get a needle biopsy to confirm
Mhm.
malignancy. Otherwise, if everything is absolutely great, the recommendation is typically either 12 months and then 24 months,
Okay.
depending on many factors, risk factors, density, etc.
Okay. Excellent.
hmm
Do you, you don't happen to have like any images you could share with us or
I could go onto the QT website and pull some stuff up. Hold on.
yeah, let's do it.
So this is the QT imaging, which they're the inventors of this entire technology. Dr. John Clock is the inventor, and he's currently reading the scans right now. But I'm hopeful that they're training more people as this gains additional popularity in more locations. But this is the machine itself. And that's the hole right here that I was telling you about that they dip the breast in. And then, like I said, you just lay down on your stomach and then just relax for about 10 to 15 minutes. And then as we go down, that's a good representation right there of what the patient's going to be doing. And then, oh, another thing that I want to note is it's a true 3D rendering of the breast. 3D ultrasound is actually not true 3D. So the radiologist gets an entire rendition of the breast to go through. And it's not even just one layer where it's nipple to chest wall. He can also go from scanning the top to the bottom in each of those layers and then from side to side as well. So he can go through each of those 3 layers, which is fantastic. And then, oh, of course, lots of great stats right there. 98% of recalls are avoidable. So recalls is additional screening, and our callback rate is much lower since we're able to see more into the breast. And then let's see. Oh, it's FDA cleared. That's important to note. A lot of women ask about that because it's such a new technology that they want to know if it's safe. So it is FDA cleared breast imaging technology and FDA cleared for dense breast screening as well. And then
Probably not covered by insurance yet.
not covered by insurance yet. We can use HSA and FSAs,
Yep.
but not insurance reimbursable at the moment. Okay, here is a great one. So they have a ton of fantastic case studies on their website and how it compares to other screening modalities. So you can have the ultrasound and the MRI. Where is it? Here we go. So they did a dense breast challenge. And so this is the same breast, but different screening modalities. And then it had confirmed cancer. So they confirmed it with a needle biopsy, and then they wanted to see how it looked in different screening modalities. So the first one here, we have a mammogram, and you can't see anything. And then here you have the 3D mammogram with the tomosynthesis. Again, can't really see anything. Handheld ultrasound, slight variation and change in the tissue here. And then you have the breast MRI. Right here is the cancer. And then you have the QT scan, also right here, visible on the QT scan. So you have the same breast and then 5 different modalities and then how that cancer looks on each of those modalities. And they have a ton of case studies on this specific type of structure and different cancer types as well. So it doesn't matter on the cancer type, it's just showing you how the breast tissue can appear completely different. So I always tell people the QT scan is much more similar imaging to an MRI, which is true. It's actually a higher voxels, which is the resolution that you measure imaging in. QT scan is higher voxels than an MRI. So it's 36 million and MRI is like 180,000.
And you don't need contrast.
You don't need contrast, which a lot of women don't know. Gadolinium is a heavy metal. But here's another one. You have the QT scan right here. So cancer typically shows up as white. And that's why I was telling you with the breast density, it's so important to have additional screening because this right here is like all the glandular tissue and density. It's like all webbing in there.
Yeah.
And then you can't see it. And then here, can't quite see it. I don't read ultrasounds. So,
Yeah.
and then you have the MRI here, non-enhancing, meaning they didn't do contrast. And so luckily it was visible. But
Yeah.
I think what people don't realize with MRIs is the gadolinium just highlights everything in the body. It doesn't attract to the cancer. You're
Right.
just highlighting everything in the body. So versus the QT scan, we're not having to do that, which is a lot better for your health. But yeah, a ton. Here we go. This is always great. So this is a comparison on each of the screening modalities and image quality. So we have, of course, the QT imaging and the MRI have higher ones, and then safety, QT is better. Speed, that's the only one we really rank half as good, and that's just on the speed of how fast the procedure is, which is still pretty fast.
Right.
And then cost efficiency, I always remind people that you have insurance involved, and like your MRI can be $2,000 with insurance. Our
Right.
scan's 550 without insurance. So everyone has their own whatever they want to spend their money on, and that's perfectly fine. I understand that. But for those women who can't afford an MRI but want the higher screening, QT is a good option for that. And then patient experience, of course, there's no pain involved and no squishing. But yeah, their website's fantastic. I love nerding out and going through their scientific papers and their clinical trials. One of my favorites is they had a scientific paper posted about their whole purpose was they wanted to prove that women postmenopausal didn't have a cycle. And so they're trying to anticipate the lack of cycle in the hormones and why there's a rise in breast cancer postmenopausal. And so what they found is QT scan can actually see the cycle based on the glandular dilation and the ductal dilation in the breast, and they can tell where women are in their cycle based on their dilation in those ducts. And what they found out is women postmenopausal are still going through a hormonal cycle. It's much lower, but they're still going through a cycle.
Tell me, what's behind this QT ultrasound and the mission and how did you guys end up here?
Yeah, so we were sending our patients. I work for True Health Center for Precision Medicine with Dr. Christine Berg, and that's what the center we're located in. And so her primary care patients were being sent down to Nevada, which is where the technology was invented. And for several years, like 4 or 5 years. And then Dr. John Clock actually reached out to Dr. Berg and was like, hey, would you want one of these machines in your office? And she was like, absolutely. So we were actually the first commercial sale of the QT scan, which is pretty fantastic. And the whole reason that we wanted to bring it to more women is more women are craving no radiation, a better experience, and just better healthcare. I mean, women's healthcare has just been known to kind of be on the back burner, and it's like, well, I guess it bothers you. I mean, I can't tell you how many women I hear say the mammogram was invented by a man, because there's
I,
no way a man going through testicular cancer screening would go through that type of vice grip on their testicles and be like, this is fine.
right, right,
So we just really want to bring this type of technology and peace of mind to women so they don't have to go through all of this terror of getting breast screening and being concerned about what's going on in their breast. I mean, I feel like even women after they get their mammogram, they're still like, okay, but what's going on? What are my breasts? I have so many women that come in with a lump, and then we're able to confirm that it's just a cyst or it's a fibroadenoma or an apocrine, whatever it may be. But we're able to just tell that that's benign, and we don't need to poke a needle in you.
right, right.
Oh, and then also, I don't think we talked about implants at all.
No, we didn't. And I want to ask you about, breast implant imaging, which is a whole topic that is, I think it's an unknown topic, honestly, to people. People don't realize the importance of imaging still around that. Not everyone can go have a mammogram post an implant. And honestly, when you talk to a radiologist, which I did a month ago, and they said, oh, you'll know it if it's ruptured.
Yeah, I
There's,
hear that
so
all the
no
time.
imaging around it. So, and the FDA recommends, I think, every 3 to 5 years for imaging if you have an implant.
Oh, wow. Yeah, it's what I love about the QT skin is because, again, you're pendulant in the water, so there's no compression. So there's no risk of rupturing that implant, like how many pounds of pressure in a mammogram. And then we're also able to tell the health of the implant. So if there's any contracture or if any signs of rupture, and that's automatically included in the report if you have implants as well. And so we're able to also see better around the implant and all the way up to the chest wall. So if there's things that are going on around the implant, we'll get a full view and be able to see better around that. And again, better peace of mind.
Right. What about people who are relatively flat chested?
You know what? If you got some, I can do it.
Okay. It's just interesting because I think of I mean, that's a whole thing with a mammogram,
Mm-hmm.
obviously. So
Yeah.
for
Which
women
I
who
can't
are
even
just
imagine doing a mammogram with no breast tissue. That has
right.
to be ridiculously painful. I don't even know how they would do that, to be honest. They would have to do a hand ultrasound or something. But for us, it's no problem because we
Okay.
get you all the way up to your chest wall. So as long as there's something there,
Oh,
we
cool.
can do it.
Good.
Hmm.
So, I don't know, Danielle, what did we miss? Did we miss anything?
Covered a lot. I liked it. It was
Yeah.
great.
What about, so if people wanted to, were interested in this technology besides, like if somebody's my patient, people can reach out to me. Um, and like how would they reach out to you? How do they connect if they were interested in getting a QT scan done?
Yeah, I would say visit our website, which is www.qbi.health. And then you can either book on the website or you can give us a call. Our direct line at the Sacramento location is 916-542-1644. And then follow us on Instagram. There's a ton of great informational stuff that we post there. Really like to keep up to date on all of like the publications, not even just with QT, but with everything else kind of going around breast cancer and breast health. So that's Clarity Breast Imaging EDH on Instagram and Facebook. But
Awesome.
educate yourself on everything that's out there and what your breast density means for your screening. That's a big thing.
Mhm. Good. Well, Danielle, thank you. This is informative. I think it's super important that people get, we just got to make people aware that there's new technology out there.
Yeah, we got to be the squeaky wheel to let them know that we're here.
We do. Yeah, thank you.
Yeah, thank you so much, Jill, for having me. This was a lot of fun.
Awesome. Thank you too.